Hi, welcome to another one of our Dr. Foot videos. In this video, I'm going to be talking to you about sesamoiditis. Now, what are sesamoids? Most bones in the body are connected to other bones via joints. The sesamoids are not connected to each other. They are loose within tendons or muscles. The largest sesamoid in the body is your kneecap, which is your patella, and they act like pulleys and they aid in the movement of the joints. The two sesamoids we have in the foot are two small P-shaped sesamoids which sit under the big toe. They're very, very important. They aid in the movement of the foot and the big toe, and the big toe takes all of your pressure at a certain stage in your gait cycle. So as you're walking, all of your weight goes through your big toe just before you toe off. Hence, they can get inflamed as you're coming off and you put all your pressure on this big toe. If you have a functional problem with the way you're walking and you're putting too much stresses on these sesamoids, you can get sesamoiditis. Itis meaning inflammation, hence you get inflammation. There are other conditions that can affect this part of the foot, which is why it's really important to visit a podiatrist and be diagnosed to make sure you've got the right diagnosis so you can get the right management plan. Something else that can happen to the sesamoids is you could get damage to the sesamoid, you could lose blood supply to the sesamoid, and that can cause a lot of pain, and that has to be treated differently. You can also get a fracture to the sesamoids that has to be picked up on x-ray. These don't get picked up on ultrasound very well, and x-ray or an MRI scan is necessary. In most cases, we don't need to even do that. We can diagnose it by palpation and by doing a couple of different clinical tests, and we can get to a management plan. Now, how we treat this? We treat this in a variety of different ways. As I said, I see a lot of athletes and professional dancers, and depending on if they've got a tournament coming up or if they've got a competition in the case of dancers, I may treat this differently. Let me give you a couple of examples. So I may start the patient off with a basic arch support to support the arch and to redistribute weight away from the sesamoids to allow the inflammation to go down. I may move that on further to an arch support with reinforced arch. It's got a blue medial phalange and a metatarsal raise, and the idea of that is to further give you even more support and take more weight off the sesamoids. We could move to a custom orthotic. So this is a custom made orthotic for a patient, and I may build in an extra pad here. Let me show you the bottom bit. Extra pad here so that I'm taking more pressure off this large toe. What I also tell my patients is I don't want you to go barefooted for a couple of weeks. So I recommend these orthotic sandals. Now these orthotic sandals have got an arch support built into it. So when the foot goes into it, you are taking even more pressure off the sesamoids. I tend to inject this joint and these type of conditions a lot, so I may do a steroid injection. If the dancer or the athlete has got a tournament coming up, I will physically strap their foot just before the tournament, just so that they can get through the tournament. And I will strap it using semi-compressed felt. I will build in an oval pad. I may lift up the first metatarsal, and I will use zinc oxide tape to give you a lot of like strapping in that area to redistribute as much weight as possible. That's a short-term thing I do for my athletes and my dancers, just so that they can get through a particular competition or a particular tournament. Other things you can do is using ibuprofen, icing it. If there's an underlying problem with your biomechanics, we need to address that. Is there something going on with the calf muscles? Are they too tight, which is why you're putting more pressure on your large toe and the sesamoids themselves? Do you have a problem with your hips? Is there a reason why you've got more internal rotation going on and you're putting more weight through those structures? So obviously we need to address all of that. In most cases, what I'm doing for this type of condition, depending on the patient, if the patient doesn't need to do a specific activity for a specific time, then I have more time to address the underlying cause and to build in a treatment plan. If the patient is an athlete, I'm really trying to firefight. So I'm trying to calm the symptoms down as quickly as possible. That could involve an injection, that could involve strapping. Shockwave works really well for this. 2 or 3 sessions of shockwave. Extracorporeal shockwave therapy is good for this. Really depends upon the individual patient. If the patient has a fracture, which is why sometimes we need to send off for an x-ray, then we would treat it completely differently. They've got to be off, they've got to be in a moon boot for a couple of weeks. However, in most cases I find there's just inflammation of the sesamoids, and we can treat this quite effectively. There's various different injection techniques, and there's various different things that we can inject into this joint, not just steroid. Anyway, if you have any questions, I hope this video was helpful. If you have any questions, let us know and we'll try and answer it as soon as possible. Thank you for listening. Bye.